Let's start. Good afternoon, all. Am I audible?
Yes, ma'am. Good afternoon.
Good afternoon. So, today we are going to talk about lymphedema. And first of all, I would like to welcome you all for the session and a special welcome for you, Shiba ma'am. And I'm handing over to Anisha ma'am to introduce our faculty. Ma'am, over to you.
Just a minute. Just a minute. The mic is on. Hi, good morning, all. This is Anusha. Today I'm your facilitator. So today our topic is lymphedema. Our speaker, Miss Shiba. She's a senior nursing officer in Palliative, India, and she's a section head, education and skill building, Trivandrum Institute of Palliative Sciences in Palliative, India, and she has a 21 years experience in palliative care, and she's a national faculty for IAPC and also National Health System Resource Center, and featured as a pioneering nursing from around the world by St. Christopher's Hospice from UK 2020. Welcome, ma'am. Welcome for this session.
Thank you. Thank you for the kind introduction. A very good afternoon to all of you. So as ma'am said, today we are going to learn about lymphedema. So we all nurses, we all know that what is lymphedema. So before I'm going to that lymphedema part, I would like to recap the lymphatic system. We all know that lymphedema is related to lymphatic system, right? So let me share my screen. Ma'am, can you give me the permission to please make me co-host?
It's already done, ma'am.
So hope my screen is visible to everyone. Somebody is please confirm. Yeah. So as I mentioned earlier, this lymphedema is related to lymphatic system. Okay. Throughout our lymphatic system, the lymphatic fluid is flowing, right? So before moving on to the lymphedema part, we have to know what is lymph. What is the content of lymphatic fluids? Okay, it is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels to lymph nodes. It contains protein, lipids, and water. So this lymphatic fluid is flowing throughout our lymphatic system. Okay, so let's see what are the major functions of the lymphatic system. So this is very, very important. If there is any problem developing in our lymphatic system, these all functions will get affected. Okay, so when you learn about lymphedema, you have to understand about the major functions of lymphatic system. The first the function is the absorb excess interstitial fluid. Wherever the lymphatic fluid is origin, the lymphatic capillaries are the responsible that thing for that absorbing the fluid from the interstitial space, so that the interstitial fluid, maybe fluid and electrolyte balance is maintaining well. And also, the second major function is the transport dietary lipids. So, in addition to collecting and in addition to absorbing the lymphatic fluids, so in our small intestine, they are responsible responsible to transport dietary lipids. And the third major function of lymphatic system is lymphocyte development and the immune response. So this is very, very important, because if there is any problem develop, so there is no lymphocytes for fight against bacteria for that particular area. So this is also very, very important. So this, we all know that what is this, right? This is our systemic circulation. Okay, so why I am highlighting this systemic circulation here is, if you think about the upper part of the body and lower part of the body, and within the lungs also, there is a connection between the arterial capillaries and the venous capillaries, right? So there is a connection between the arterial capillaries and the venous capillaries. Our lower part of the body also, the same thing is happening. It's a connection between the arterial capillaries and the venous capillaries. From the lower part of the body, with the help of a inferior vena cava, the impure blood or the deoxygenated blood is going to the right atrium. From the right atrium, it goes to right ventricle, and then from right ventricle, with the help of a pulmonary artery, it goes to right and left lungs for purification of blood, right? So this is our systemic circulation. The same thing happening in our upper part of the body also. Okay, so why I am highlighting here this systemic circulation is, you have to understand that there is a connection between the arterial capillaries and the venous capillaries. Okay, so let's see what is happening when the arterial capillaries and the venous capillaries are communicating together. So here you can see this, there is a communication. When the arterial capillaries and the venous capillaries are communicating, like exchanging the blood for the purification, so there is a chance of oozing out of fluid-like substance into the interstitial space, tissue spaces. That is called lymph. Clear? Are you with me? So there is a connection between the arterial capillaries and the venous capillaries. Wherever the arterial capillaries and the venous capillaries are communicating together or exchanging the blood together, so there is a chance of oozing out of fluid-like substance into the interstitial space, tissue spaces, that is called lymph. That fluid is absorbed with the help of a lymphatic capillaries, which is, you can see the greenish color. Okay, so the lymphatic capillaries are the responsible thing for absorbing the interstitial fluid or a lymphatic fluid from the interstitial tissue spaces. You can see here also, it looked like a clustered form. So wherever the fluid is leaking, the fluid will be absorbed with the help of a lymphatic capillaries. So let's see the structure. It has a blind end and single layer of overlapping endothelial cells. You can see here. So this is a single layer is overlapping into the cells and more permeable than that of blood capillary. That is also very, very important, because little big molecule is also absorbed and can be able to absorb with the help of a lymphatic capillaries. Now we have to learn about the lactase. So I had already mentioned about the functions of lymphatic system. The second major functions of lymphatic system is transport dietary lipids, right? So here in our intestine, we have that special type of that lymphatic capillaries called lactase. So they will be picking up of interstitial fluid, and also they'll supply the dietary lipids and lipid soluble vitamins. So because of the mixing together, that soluble vitamins and the lymphatic that fluid is mixing together, that part of the lymphatic fluid is look like a milky color. So that's called chyme. So next you have to learn about lymph nodes. This is one of the important, that major part in our lymphatic system. So this has an important role in our lymphatic system. In our body, it's around 600 to 700 lymph nodes are there. So it has a small round oval shape located along the pathways of the lymphatic vessels. You can see this picture along with the pathways of lymphatic vessel, lymphatic system. In between, one lymph node will be there. And so length is from 6 to 25 millimeters, typically found in clusters. So receive lymph from many body regions. That their primary responsibility is to receive lymphatic fluid from many body regions, and then their major function is to filter out the harmful substance from the lymphatic fluid. Okay. So next is lymph organs. You all know that these are some lymph organs: tonsils, thymus, lymph vessels, lymph nodes, spleen, bone marrow. These all will be helping us to that fight against bacteria. They will try to protect us from the infections. Okay. Coming to the lymphatic drainage, so we have two major ducts. One is right lymphatic duct, and the second one is thoracic duct. So here you can see this picture. From this part of lymphatic fluid is flowing into the right lymphatic duct, and rest of the part is going to the thoracic duct. Through this, it goes to subclavian vein. Okay, so here you can see this picture also. So there is the final end of the lymphatic system is to the subclavian vein. So after the issue that transferring the fluid from the lymphatic system to subclavian vein, so that's why we always said like lymphatic system is also is a part of circulatory system. Okay, this picture I already explained, so let me that explain once again. This is very important. So if you don't know this, it's very difficult to learn lymphedema. Okay, so here there is a connection between the arterial capillaries and the venous capillaries. So wherever the connection, that exchanging of blood that things is happening together, there is a chance of leaking out of fluid-like substance into the interstitial tissue space, that is called lymphatic fluid. So that fluid is absorbed with the help of a lymphatic capillaries. So what is the flow chart? So as I mentioned earlier, the lymphatic system circulates protein-rich lymphatic fluid. Okay, so it might be contains bacteria, virus, and waste products. Okay, so wherever the lymphatic fluid is virgin, the lymphatic capillaries are responsible for them to absorb it, right? So, but the lymphatic capillaries doesn't know it has bacteria, virus, or waste products. Clear? Are you with me? So, from the lymphatic capillaries, it goes to lymphatic vessels, and it goes to the lymph node through the lymphatic vessels. Okay. Again, it goes to lymphatic vessels. Again, it enters into the next lymph nodes. Finally, through the collecting duct, it goes to the subclavian vein. The major function of the lymphatic system, the lymph node, is to filter out the harmful substance from the lymph node. So, wherever the fluid is originated, the lymphatic capillaries are absorbed from the interstitial tissue space, and then it goes to lymph node through the lymphatic vessels. The lymph node are therefore filter out the harmful substance from the lymphatic fluid, and then the waste are flushed from the body, and the clean lymphatic fluid is drained into the bloodstream. So this is how our lymphatic system works. Okay, I hope this anatomy is clear to everyone. So now we are going to learn about lymphedema. So lymphedema is a pathological accumulation of protein-rich lymph fluid into the interstitial tissue space due to an imbalance between the interstitial fluid production and transport. So this is lymphedema. What is the important point here? Here, the production will be there in all the time because there is a mandatory thing is happening in our interstitial tissue spaces because the arterial capillaries and the venous capillaries are communicating together all the time, right? So here, what happened? The production will be there all the time, but the transportation will be difficult. How the transportation will be difficult? For example, if a person is diagnosed with a CA carcinoma, CA breast, the next treatment is, the curative treatment is to remove the breast, right? Radical mastectomy is the next curative option. When we do the radical mastectomy, what we usually done? We removal of breast and then we will remove the adjacent lymph nodes also. Why we removing the adjacent lymph nodes? For spreading, for preventing preventing for spreading disease from one area to the next area. For that, for saving the patients, we removing the adjacent lymph nodes also, right? So when we removing the adjacent lymph nodes, the transportation will be difficult. The production will be there, but the transportation will be difficult. So that leads to the accumulation of protein-rich fluid into the interstitial tissue spaces. Then gradually the edema will be there. According to the International Society of Lymphology, the lymphedema is classified into two, primary and secondary. Primary is congenital lymphatic dysplasia. From the birth itself, there is a malformation. There is a deformity. There is a maybe lot of that lack of lymphatic system is formulation or any other hereditary issues. Maybe congenital issues will be there. That is comes under primary. And secondary is anatomical obliteration of the lymphatic system. Okay, so now our anatomy is good. If there is any happening in our body, so there some changes will be there. So, for example, we when we remove breast, we will remove the adjacent lymph nodes also. That is the anatomical obliteration of the lymphatic system. Secondary again divided into two, non-malignant and malignant. So from this slide, I would like to highlight one important point here is, so for the non-malignant persons can also develop lymphedema. For example, road traffic accident, if the patient maybe get the major road traffic accident maybe and that time it will affect the major lymph nodes. Okay, so that maybe gradually that patients might have developed lymphedema. Recurrent infections, surgery and radiotherapy. So these all will be treatment related causes and that leads to maybe that patients can get edema later on. And coming to the malignant, primary lymphomas and secondary recurrent. So from this slide, you have to understand that the non-malignant persons can also develop lymphedema. So let me go through a case scenario. Miss S, 50-year, was diagnosed with carcinoma breast left with lymph node metastasis about 1.5 years ago. She underwent modified radical mastectomy with axillary dissection followed by chemotherapy and radiation. She has been noticing that her left upper limb is progressively getting swollen for the past 3 months. She feels it heavy and experiences pin and needle sensation along the whole limb. What is the probable diagnosis? Can anyone say? Anybody, please respond. What do you think? What do you think? From this patient story, what is your probable diagnosis? No response?
Ma'am, there is blockage in the lymphatic system,
Okay, very good.
and due to which it is lymphedema.
Yeah, so there is so the probable diagnosis is lymphedema, right? So here, this patient was diagnosed with carcinoma breast. And for that, she underwent a modified radical mastectomy with axillary dissection. So the axillary dissection is already done. So there is no lymph node for take care of that particular part lymphatic fluid. The production is there, the transportation is blocked. Followed by chemotherapy and radiation. Again, chemotherapy and radiation can also another cause for getting lymphedema. So this patient has been noticing her left limb, upper limb is progressively getting swollen for the past 3 months. So since lymphedema is gradually developing. Okay, so if you are treated in the earlier stage, we can able to control. Okay, so here since last 3 months she is having edema, and also now she feels it heavy. She is not able to maybe manage her the swollen limb because of the heaviness, and experience pin and needle sensation, because our skin will try to stretch maximum, but after that, after point of time, that's the skin will maybe the patient may feel pain. So usually the pin and needle sensation, like neuropathic numbness and neuropathic pain like sensation will be there. So this patient is having lymphedema. So how do we diagnose lymphedema? The first important point is history. You have to take a proper history, whether there is any unknown cause, whether there is any disease related or trauma related, whether there is any treatment related. So if you take a proper history, you will be able to understand that whether the patient is having lymphedema or not, because not all edema is lymphedema. Okay, so few other conditions like renal failure and cardiac failure, patients can get edema, right? So from the history itself, you can able to understand that whether the patient is having lymphedema or other disease related edema. And then next, the important point is clinical examination. After taking proper history, then you can do the clinical examination. So there are 4 stages of lymphedema. You start the stage with 0. Okay, the stage 0 is subclinical stage where swelling is not evident. Okay, so that means if a patient is underwent a radical mastectomy, but particular patients can get edema later on. But when you see that patients, there is no lymphedema. That is stage 0. But that patients can get lymphedema later on. So that is stage 0. Clear? And stage 1 is swollen stage, like orange peel skin. If you can able to, if you are if you will give your own finger pressure on that area, you can able to see your finger points. Okay, finger pressure points there. So this is the stage 1. So if you're not given proper attention to the stage 1, it goes to stage 2. There, the tissues have become fibrotic. Little bit tissue that hardness will be there, no longer soft. So this is the second stage. And the third stage is the tissues are considerably hard and cartilage formation will be there. Sometimes creases formation will be there. So if there is a creases formation there is a chance of dirt accumulated in between the creases, and that leads to fungal infection. So next is the stemmer sign. This sign which you have seen only in lymphedema patients. So you have to understand that what is tremor sign. Okay. In a healthy person, you can able to fold the skin or a pinch and lift up the base of the second toe or a middle finger. For example, if you look into the upper arm, you can able to lift up your skin over the middle finger. Okay. So if you can able to lift up the skin over the middle finger, that is the negative, that is normal. But for a lymphedema patient, you can't. Inability to pick up the fold of skin over the proximal phalanx of the second toe or a middle finger. That is the positive sign of lymphedema. Clear? So, in Western countries, if a patient is having lymphedema, they will be, when they document it, they will be documented is an lymphedema present, is lymphedema plus and stemmer sign positive. So, this is the that only one sign which you have seen in lymphedema. Coming to the other diagnostic methodologies, so you can do soft tissue imagining, lymph vessel imaging, and bioimpedance spectroscopy. If you can do these, you can able to determine the extra fluid volume, you can able to detect abnormalities, and also you can able to measure the interstitial fluid volume also. Here, what you have to understand is, for a palliative care patients, from the history itself, you can able to understand that what is the cause of lymphedema. Okay, so here you don't need to do these kind of expensive investigations. Okay, so you have to do one thing for that. And on the another side, if the patient is having the primary lymphedema, as we discussed earlier, for the classification, it has divided into two. If there is a primary lymphedema, there is a congenital abnormalities. For that, you have to find out whether there is any correctable factors. That patients, you should do this kind of investigation and find out the cause and treat the underlying cause. Coming to the problems. So problems, we all already discussed. Pain and discomfort will be there because of the fluid volume. Tightness will be there. Heaviness will be there. Fatigue will be there, and numbness. They won't feel anything. If you touch that area, so they said like I won't feel anything. Numbness will be there. Impaired mobility. They will not be able to move their that limb independently. So they always that seek help from others, and loss of functions. It will be affecting their daily day-to-day activities also. If they are not able to maybe take care of their own self-care, so it will be affecting their emotional thing. So we all, from the first day itself, you all understand that the importance of total pain, right? So the total pain is very, very important. Always remember the total pain concept, and not only the physical aspects, you have to, if you are not treat the physical aspects, it goes to the emotional, social, and spiritual aspects also. If that leads to the patients will go end up into the that emotions. So we have to treat. If the patient functional level is affecting, we have to understand their functional activity, the day-to-day activities, and you have to try to manage, and we have to motivate as much as we can. Okay, so next thing is psychosocial problem. So this is body image. So the major problem here, the psychosocial part, is body image. So I have seen many patients with lymphedema. Whenever they come to the OPD, they used to cover their lymphatic, that lymphedema part with their maybe their own dupatta or their own sari, or whatever they have, they will cover. So they don't want to expose the lymphedema part to others, because if they are exposed to the public, they will ask many questions. They need to answer many questions. Okay, so that's why they usually they cover the edematous area with their own dupatta, and if you ask them, they usually tell like this only. And loss of independence, as I mentioned earlier, so they will not be able to that do their daily things without help. So it will be affecting them emotionally. Loss of change of employment, so this will not be affecting the, maybe they will not be continue their daily their job because of this edema. And difficulty in wearing clothes and shoes, they will not be able to, because if you think about a lower lymphedema, they will not be able to wear the shoes. So it will be affecting the patients emotionally. Anxiety and depression, so usually they will be in anxious. If you are not looking into that anxious period, if you are not given attention to the anxious period, the patients might go to depression. Okay, so the anxiety, addressing the anxiety is very, very important, because if they have developed lymphedema, they might be thinking like, okay, my disease is spreading to my hand also. We all know that this is a part of maybe part of after the surgery, because we all know that because of the lack of lymph node in their axilla, the collection of fluid is there that leads to lymphedema. But the patient will be thinking like, okay, my disease is spreading to my hand also. Now I am very worried, so I don't want to live. So these kind of things will be there. So these things, what we have to do is, when they come to you, sit and listen and explore their emotions, explore their insight about the disease. So once you can able to explore their insight, you can able to solve many problems. You can able to convince the patients what is lymphedema, how can we treat lymphedema, what all things they have to do. So these all things you have to tell them. And constant reminder of disease, and also obviously social isolation will be there because of the misconception of disease. If a person's diagnosed with this kind of disease like cancer, the people are thinking like, okay, this cancer is spreading to me also, so better to don't go to sit near to her, and maybe that will be spreading to me also. So these kind of that misunderstanding will be, misconceptions will be there. So if there is a misconception there, better to sit with the patients and talk to the patients and understand her insight, and based on her insight, you can able to you can able to solve many problems. So then now we are moving on to the management part. So there are 4 principles of management of lymphedema. One is skin care, and the second one is massage, and the third one is compression bandaging, and the fourth one is exercise. So these are the 4 principles of management of the lymphedema. I'll come to the intermittent pneumatic compression pump later. So this is very, very important. I already said, when we remove a lymph node from an adjacent area, there is no lymphocytes for fight against bacteria. That area is prone to develop infection. So prone to develop infection, because if there is accidental cut happen, sometimes the infections, the bacteria will enter through that area, through that cut. So when the bacteria enter into that particular area, if there is no lymphocytes there, so there is no fighting is happening. So easily the bacteria will enter in our body. Okay, so here, if the bacteria enter in that area, what happened? The cellulitis, that particular area is prone to develop a cellulitis. Before moving on to now we learned about the 4 principles of management of lymphedema: skin care, massage, bandaging, and exercise. So before moving on to the management part, you have to take a measurement. So this is very, very important. When they come first, you have to take both limbs. Then only we can able to differentiate which limb is more fluid, it has more fluid. So the initial stage, the first day, you have to take both limbs measurement. For the upper limbs, you head of the ulna plus 2 centimeter, then every 4 centimeter you can mark like this and take a circumference. And for the lower limb, from ankle joint plus 2 centimeter, then every 4 centimeter. The same thing, same way you can able to, you just mark the point first and then take a circumference. Coming to the management part, skin care. As I already mentioned, the skin care is only one of the important part. The education of skin care is very, very important. You have to tell them apply simple moisturizing cream. So if they don't have a simple moisturizing cream, you can tell them to use coconut oil. So that is enough, because when they want to apply moisturizing cream, so after just finishing a bath, so just finish after the bath, they can immediately they have to apply some simple moisturizing cream, and that way we can able to prevent dryness and meticulous drying between the digits. So in between the digits, so there is a chance of dirt accumulated like a creases. If there is a creases formation there, same thing happen. So here there is a chance of dirt accumulated in between the digits, and then followed by that fungal infection. So we have to tell them to give attention to that area. Avoid injections and veiny punches. So if you do, better to avoid injections and veiny puncture. If you give injections and veiny puncture, is nothing happen. But if there is any aseptic techniques that you are not following in aseptic techniques, there is a chance of infection. So if there is a bacteria, maybe infections enter into that puncture, so that patients will get a cellulitis. Avoid rushes and avoid blood pressure cuffs for that particular area, and try to avoid injury. Keep cuts. So here, for example, see a breast. The most of the women are working in the kitchen, right? Accidentally cut can happen. So here, what here you have to do is tell them to that prevent injury. So try to avoid cut. But if there is accidentally happen, they have to clean that area, keep that area clean and dry. If there is any signs and symptoms of infections, they have to take an antibiotics for that and control the infection. And also you have to tell them to avoid carrying heavy things. If they take heavy things, what happens? Their blood circulation improves. If that leads to lymphedema increase. The next principle is massage. So there are two different types of massage: manual lymphatic drainage and the simple lymphatic drainage. So the manual lymphatic drainage is done by the trained professional. The simple lymphatic drainage is done by the patient with the help of a caregiver or a volunteer. Okay. The difference between the manual lymphatic drainage and the lymphatic drainage is, so the affected limb is not you can able to give massage for a trained, if a trained person there, you can able to give massage to the affected area. Because why I am highlighting this point here, point here is, if you tell the patient to give a massage to the affected area, they will give more pressure. Their intention is good. They will try to give good massage to that particular area. If you give a more pressure to that area, what happens? The blood circulation will increase. That leads to edema get worsen. Okay, so here you have to tell them, if there is a trained professional there, they can able to give a good massage to the affected area also. But for a that person who is suffering from lymphedema, they should not touch the affected area. All other things they can do. They can take deep breathing exercise, because if they take a deep breathing exercise, all lymph nodes will get stimulated automatically. Okay, so you can tell the patient to take a deep breathing exercise, and then they can able to stimulate the superficial lymph nodes, so that we are going to push the fluid from the congested area to the non-congested area, right? So we are trying to push the fluid from the edematous area to the non-edematous area. So the non-edematous area lymph nodes are functioning well. Our aim is to push the fluid from the edematous area to the non-edematous area. Okay, so if there is a trained professional there, you can able to do the massage. But otherwise, They can do deep breathing exercise. They can stimulate the superficial lymph nodes. They can stimulate the opposite side of the unaffected axilla, and also they can do the bandaging and exercise. So the last two part is done by a trained professional. If the trained professional there, the trained professional can be able to do the massage on their affected area. So there are few contraindications. Acute cellulitis. If there is an acute cellulitis there, the patient is not able to maybe do the massage, because pain will be there, redness will be there. They will not be able to move their affected area because of the infection. So if there is an acute cellulitis there, you have to treat the cellulitis. Okay. And then renal failure. If there is a renal failure there, we are going to push the fluid from the affected area to the non-affected area. If you push extra fluid to that area, again, maybe that leads to fluid overload, and the patients will develop breathlessness, unstable hypertension, severe cardiac problem, and hepatic cirrhosis with huge ascites there. If there is a huge ascites there, so our intention is to remove the ascitic fluid. Okay, so if that ascites is affecting their maybe day-to-day activities, that maybe that leads to breathlessness. If there is a breathlessness leads to ascites there, definitely we have to do the ascitic tapping and give relief to that breathlessness. And then again, if there is a huge ascites there, we can't do the manual lymphatic drainage and superior vena cava obstruction. So this is one of the palliative care emergency, superior vena cava obstruction. If there is an obstruction there, if you push the fluid from that area to the superior vena cava region, for example, head and neck cancers. If the patient is developing lymphedema to their right or left arm, if you push the fluid from that area to the chest region, again the superior vena cava will get overloaded, and that leads to breathlessness. So we have a video on that. I'll show it to you later. And the next part is bandaging. After massaging, you can do the bandaging. But if you are not doing the massaging, because if you don't have a trained professionals, better to tell the patient to take a deep breathing exercise and stimulate the superficial lymph node, and then they can wear that bandages. You can train the caregivers. You can train the patient relatives for how to put a bandaging. So usually we will give a spiral bandaging, that is 50% overlap in the initial stage. If they are able to tolerate the spiral bandaging, then we will move on to the figure of 8 bandaging. Because if you given the figure of 8 bandaging initially, most of the time they won't be able to tolerate. After that, they will not come for follow-up also because of the tolerating issues. So better to go with the spiral bandaging first, and educate the caregivers also. And next follow-up time, you have to ask them whether they can able to tolerate the bandages or not. If they are able to tolerate the bandages, then you can move on to the figure of 8, so that multiple pressure will be there, so that we can able to relieve that edema. For the lower limb also the same thing. For the fingers and the legs, you can do the same way. For the fingers, you can take a small bandages. If that 2 centimeter bandages on 3 centimeter bandages are not available in the shop. So what we do here is we used to take a 6 centimeters bandage and fold it into 2. So that 3 centimeters bandage will be, you will get 3 centimeter size bandages that we used to use for the finger bandaging. Okay, for the upper and lower limbs. And then you can take the 8 centimeter bandage and do the bandages for the whole legs. And then the next part is exercise and elevation. So after bandaging, you have to tell the patient to do some few simple exercise, one for their fingers, one for their wrist, one for their elbow, and one for their shoulder. So after that, you have to tell them to take a deep breathing exercise again and lie down for a maybe few hours. So they have to maybe their affected limb, they have to support with a one or two pillows so that the limb will get up, and then so that that fluid will drain easily. So after the exercise, you have to tell them to take a deep breathing exercise and relax for some time, at least 1 hours. The minimum 30 minutes, at least 30 minutes they have to lie down, so that all that extra fluids will that go up into that non-affected area. So this is the intermittent pneumatic compression pump. So this is a electrical air compression pump which is attached to the inflatable plastic garment. So you can see this picture. For the affected limb, if there is a stage 1 lymphedema, this will be helpful. So the pitting edema stage will be there. You can able to put your lymphedema, the legs or a hand in this inflatable garment like this. You can able to adjust the pressure and the duration, and this will give a continuous intermittent pressure to that affected area, so that all fluid will move up. That is the idea behind this. So there are two complications of lymphedema. One is cellulitis. I already explained there is an infection. If there is a cellulitis there, you have to treat the cellulitis, give antibiotics for this cellulitis, and control cellulitis. So we all know that if there is an infections or inflammation there, pain will be there, swelling will be there, warmth will be there, redness. These all are the signs and symptoms of inflammation, right? So if there is these kind of things there, you have to give some antibiotic and try to treat the that cellulitis. Once the cellulitis is reduced, then you can think about the active management. Okay. So the second important the complication is the major complication is that lymphoria. Lymphoria means leaking out of fluid, that lymphatic fluid from the edematous limb. Okay, so this is lymphoria. If there is a lymphoria there, you can apply that crepe bandages. No issue. Do one thing. You can put a dressing pad on that lymphoria site and protect that area, and then you can apply crepe bandages so that all excess fluid will come out. So thank you. The theory part is over. Any doubts? If you have any doubts, please ask me. Otherwise, I'll show that video on manual lymphatic drainage.
Dear participants, if you have any doubts, please put it in chat box. Otherwise, you can unmute your mic and ask.
So we all nurses, please ask few questions.
Raj Kiran, Richa Sharma, Kavita Neetu. Anyone have any doubts? Sunita, Manisha, Manju, Rajan, Santosh. No one? Everyone understand?
Ma'am, in this, do we have to keep the limb elevated?
After bandaging and exercise, you have to tell the patient to elevate that area with the 1 or 2 pillows and lie down for few hours, so that all extra that collected fluid will move up.
Thank you.
And also you have to tell them to take a deep breathing exercise after that. So let me, thank you. Let me show that video. So this is about the manual lymphatic drainage. Please watch this. This is about to take 1 hour, the procedures. Usually if you want to do the manual lymphatic drainage, the manual lymphatic drainage is done by a trained professional. If you want to do a manual lymphatic drainage, you will take 1 hour for this. This is a 10 minutes video. So what the important points we were highlighted here. Let's watch this video.
Part 1. Manual lymphatic drainage or massage. Gemma is suffering from breast cancer and has developed lymphedema on her right arm. She has been admitted to the hospital for the management of lymphedema. Lymphedema is a condition in which excess fluid called lymph collects in tissues of the body and causes swelling. 4 common steps of management of lymphedema are manual lymphatic drainage or massage, compression bandaging or hoisere, exercises and skin care. Sister Sandhya is going to perform manual lymphatic drainage procedure on Gemma. This is done by trained professionals only. This will be followed by compression bandaging of the arm and educating Gemma on exercises and skin care. Manual lymphatic drainage. Manual lymphatic drainage is a light skin stretching technique to stimulate the lymphatic system. This massage helps to move fluid away from areas of the body that may be swollen by lymphedema to the areas with normal lymphatic flow. Before starting the massage, it is important to measure and record the girth of the affected and unaffected arm. This will help to assess the effectiveness of the measures taken for lymphedema management. Articles required: 1 measuring tape, 1 marker pen, 1 pair clean gloves, lymphedema chart. Procedure: greet the patient and caregiver. Explain procedure to the patient and caregiver and take consent. Provide privacy. Wash hands and wear clean gloves. Provide a comfortable position to the patient. Place the affected arm supported by a pillow over a table. First, measure the girth of the affected arm. The first measurement should be from the head of the ulna plus 2 cm and then at every 4 cm intervals up to the shoulder joint. Mark the points with a marker pen and then measure the girth. Document the measurement properly in a lymphedema chart. Repeat the same procedure on the unaffected arm and document. Instructions for doing massage. Use gentle pressure to stretch the skin as far as it naturally goes and then release the pressure to let the skin come back as it was. Use the flat of the hands instead of fingertips. This will allow more contact with the skin to stimulate the lymph vessels. Do not massage if there is pain or redness on the arm. Procedure: start with deep abdominal breathing. This helps to stimulate the lymphatic system in the whole body. Ask the patient to place the palms of hands on the stomach and then to slowly breathe in deeply through the nose and breathe out slowly through the mouth, pursing the lips. The abdomen should rise with the intake of breath. The abdomen should fall back and flatten on breathing out. Repeat 5 to 10 times. Ask the patient to take a short rest between each breath. Now stimulate the neck nodes. Massage the front of neck. Stimulate the supraclavicular nodes above the collarbone on both sides of the front of the neck by stretching and releasing the skin in a J-shaped manner as shown. Repeat 5 to 10 times. Massage sides of the neck. Stretch the skin on the sides of the neck away from the face and release. This is to stimulate the neck nodes. Repeat 5 to 10 times. Massage the back of the neck. Stretch the skin downwards on the back of the neck on both sides and release. Repeat 5 to 10 times. Massage the unaffected axilla. This is to stimulate the axillary nodes. Place the palm against the unaffected axilla. Gently pull up the skin and in towards the body, then release. Repeat 5 to 10 times. Massage the upper chest. Stretch and release the skin from upper chest to neck on the affected area. This step will move fluid up to the neck nodes. Repeat 5 to 10 times. Prepare the chest. Stretch the skin over the chest and release in small strokes. Start close to the affected axilla and massage across the chest over to the unaffected axilla. This will help the fluid to move away from the affected axilla to the lymph nodes, the unaffected axilla. It will also prepare the chest to receive more fluid from the affected arm. Repeat 5 to 10 times. Prepare groin area. This stimulates the healthy inguinal nodes on the affected side. Stretch the skin upwards towards the umbilicus and release. Repeat 5 to 10 times. Prepare the trunk. Gently stretch and release the skin from the chest on the affected side down the side of the body to the groin area. Repeat 5 to 10 times. Then stretch and release the skin from under the affected axilla down to the groin. We shall now start the massage of the affected arm. Massage the upper arm. Start at the shoulder and gently stretch and release the skin, moving over shoulder towards the neck and across the chest towards the opposite axilla. Repeat 5 to 10 times. Then stretch and release the skin from the inside and outside of arm to the top of upper arm and up the shoulder. Repeat the shoulder step to finish. Repeat 5 to 10 times. Massage the forearm. Stretch and release the skin from inside the forearm to the back of the arm and release. Then stretch and release the skin on the outer side of the forearm to the upper arm. Repeat the shoulder step to finish. Repeat 5 to 10 times. Massage of swollen hand. Gently stretch the skin on the back of the hand towards the forearm and release. Repeat 5 to 10 times. Massage the swollen fingers. Place your index finger and thumb on the swollen fingers. Gently stretch and release the skin towards the palm and massage the entire finger. Repeat 5 to 10 times. Then do the entire sequence of pushing the fluid up to the arm and shoulder, across the chest to the healthy axilla, then down the chest towards the groin about 5 to 10 times. Repeat deep abdominal breathing. Finish the massage by asking the patient to repeat the deep abdominal breathing 5 to 10 times. This finishes the procedure for manual lymphatic drainage. This
Hope this video is clear to everyone. Any doubts regarding the manual lymphatic
Doubt,
drainage?
ma'am.
Yes.
Reactive mesenteric lymphadenopathy, ma'am. Is it dangerous?
Sorry.
Reactive mesenteric lymphadenopathy. Is it dangerous?
Yeah, if there is a lymphadenopathy there, do one thing, you have to check whether there is any metastasis. If there is a metastasis or any disease related things there, lymphadenopathy will there. So you have to check. Who was asking? Anusha?
Anshu.
Yeah, Anushu. Why did you ask this question?
Good afternoon, ma'am.
Yes. Why did you ask this
Ma'am,
question?
here's a patient. He's having jaundice and hepatomegaly. And in his ultrasound, this is reactive mesenteric lymphadenopathy was written. And they showed this they've shown this to some other physician,
Okay.
and they said this is quite dangerous.
Yeah. So if there is a hepatocellular things there, so maybe adjacent lymph nodes is get affected and metastasis will be there. Maybe the inguinal lymph node also will get affected. So this is dangerous. If
Okay.
this is dangerous because this patient is already carcinoma, right? So that leads to some metastasis is there. So this is dangerous. You have to treat.
Okay, ma'am.
Okay.
Thank you, ma'am.
Okay. So we have one more video. Let me show that video also so that you will get a good idea about that.
The arm. Part 2. Compression bandaging. Compression bandaging is layered bandaging of the affected limb to control swelling. It should be taught to the caregivers so that it can be done daily at home. Articles required. Thin layered cotton roll covered with gauze piece 1 3 cm crepe bandage, 1 6 cm crepe bandage, 2 8 cm crepe bandage, 1 pair of clean gloves, 2 dressing pads, 1 adhesive tape. Procedure. Start with cotton padding wrap. Make a small hole at one end in the cotton padding. Start wrapping around the thumb of the affected arm from the wrist in a spiral pattern till the shoulder joint as shown. Fix the end of the bandage with adhesive plaster. Wrap the fingers with 3 cm crepe bandage. Start wrapping the bandage slowly around the wrist and then wrap the thumb first. Bring the bandage up towards the bottom of the thumbnail. Start wrapping from the bottom of the thumbnail around the thumb 3 times towards the base of the thumb. Wrap the bandage around the wrist again. Continue wrapping each finger the same way, ending with wrapping around the wrist. Keep the nails free. Fix the end of the bandage with adhesive plaster. Do not use metal clips to fix. Then spiral wrap forearm with crepe bandage. Begin with 6 cm bandage. Wrap around the wrist once without pulling. This will secure the bandage. Now continue wrapping the same bandage up the arm in a spiral manner. Overlap the bandage by half with each wrap. Always give a gentle pull on the bandage at each half turn to keep an even pressure. Continue the same way till you reach the elbow. Fix the end of the bandage to stop it from getting loose. Place an extra cotton pad on the hollow of the elbow to ensure evenness of the surface. Now take the 8 cm bandage. Wrap the bandage over the elbow in the figure of 8 with elbow bent slightly. Continue wrapping in a spiral manner all the way up to the top of the arm. Fix the end of the bandage with adhesive plaster. Examine nails for any bluish discoloration after the procedure. Support the bandaged limb with a pillow. Ensure the patient is comfortable without any pain or discomfort in the arm. This completes the procedure for compression bandaging. Review the patient after 1 week. Measurement of the arms should be taken and compared with previous recordings. If the patient can tolerate the spiral bandaging, figure of 8 bandaging for the arm can be given. For this, the finger bandaging remains the same. Figure of 8 bandaging increases the number of layers of bandage applied and results in higher sub-bandage pressures than spiral bandaging. This procedure should also be taught to the caregivers. Exercises. Along with compression, special exercises will help to pump lymph out of the swollen area. Exercises are done at the level of fingers, wrist, elbow, and shoulder. Deep abdominal breathing should always be done at the beginning of the exercises at least 5 to 10 times. Shrug the shoulders and bring it down 10 times. Lift the arm up above the shoulders and bring it down. Do it 10 times. Bend the elbow and try to touch the nose. Then straighten the elbow. Repeat this 10 times. Move the wrist in a rotatory fashion and up and down. Repeat this 10 times. For fingers, squeeze a physiotherapy ball. Do it 10 times. Deep abdominal breathing should always be done at the end of the exercises at least 5 to 10 times. Skin care. Educate patient on the methods for skin care of the affected arm to prevent infections. Always keep the affected arm clean and dry. Wash the affected arm with unperfumed soap and water regularly. Pay special attention to the spaces between the fingers and the creases. Apply white petroleum jelly while the skin is wet. This is to keep the skin lubricated and supple. Pat dry the skin and the spaces between fingers with a soft, clean towel. Do not rub the skin with the towel. Avoid tight clothing or jewelry on the affected arm. Avoid needle pricks on the affected arm, either for IV fluids or for checking blood sugar or drawing a blood sample. Do not use the arm for recording blood pressure. Do not scratch the arm with your fingernails. This will lead to trauma and infection. Do not lift heavy weights with the affected arm. Do not apply heat on the affected arm.
Oh, this video is also clear to everyone. So now I hope lymphedema is little clear to everyone. Any doubts? So I know in your busy schedule, you may not be able to do the manual lymphatic drainage and all, but at least you can, whenever you have seen a lymphedema patients, you can educate the patient about skin care, bandaging and exercise. At least these things you can teach. You can tell the patient to take a deep breathing exercise. They have to give attention to that affected area, protect that area from infections. These all things you have to. But if you have time, you can give manual lymphatic drainage. Otherwise, you can refer the patient to that particular maybe nearest palliative care unit or a cancer center for better care. I know this you need a hands-on training. In addition to, I already said you can educate the patient on that skin care, bandaging, and exercise. So these all things you can do.
Yeah, thank you so much. No, it was very good session. I think everyone should understand.
So if they don't have a questions, we can wind up.
Okay.
Thank you, ma'am.
Any questions? Yeah. Anshu.
No questions, ma'am. Thank you.
Yeah. Thank you. Thank you for asking that questions. Thank you. Okay.
Thank you, ma'am. Thank you for your insightful session. And you can leave now.
Okay. Thank you. Bye.
So thank you, participants. We can wrap it up today. So you can leave now.